This morning, the Ohio Senate continues to talk about the Medicaid reimbursement budget for 24-25. But some Ohioans are already seeing the ripple effect. With Medicaid coverage ending for many in the coming months, they'll be without services that were once covered. Zeinab Cheaib dug into this issue, speaking with a local woman about the impacts.
A local woman who tells me she's experienced a lack of home health care aid in our community. Carol believes it's because of a low worker pay under the Medicaid benefits.
My needs were not time sensitive. If you're somebody who needs that morning care, then it is time sensitive. And maybe you don't have a friend who can come when you have that need.
Carol is a senior citizen in the Toledo area. She fears that the elderly and people with disabilities are at risk of losing care because of the lack of available home health care workers.
The companies can't pay the aides something that they can support their families on. And like I said, they're paying for their own gas. So that's an expense.
With Medicare reimbursement rates no longer covering the cost of care and preventing agencies from paying competitive wages, that means agencies who are unable to cover the cost of care are moving away from providing care to Medicaid recipients.
The biggest impact is the inability to pay a market wage. So we're competing with other providers who employ the same nurses and the same types of people in their agency. And in some cases, they can pay them, up to $10 more an hour for the same job.
The lack of competitive pay for caregivers adds to an ongoing healthcare workforce shortage. Fatu is Carol's aide, and even though she enjoys spending time providing care for her client, she's still living paycheck to paycheck.
Economy's getting rough, and gas is getting expensive. Utilities are getting expensive. People have bills to pay, so at the moment it's good enough, but it's not the best.
In Toledo.
That was our Zeinab Cheaib reporting. Now tomorrow, the Ohio Senate plans to hold a hearing to discuss Medicaid payment as part of the state budget. You can follow WTOL 11 on air and online to get those updates on this issue.